So there's a revolution going on where we now have a whole series of tools where we can electrically stimulate the brain. Some of them invasive, some of them non-invasive. And they are being used as research tools, trying to figure out how the brain works. And some of them are working their way into becoming treatments. The one that probably has the most excitement at the moment is a thing called TMS, or transcranial magnetic stimulation. And that's where you actually take an electromagnet about the size of your hand, you put it on the head and turn it on and off. It creates a very powerful magnetic field that goes unimpeded into the brain, and there it induces an electrical current in the cortex. So you can actually non-invasively, and somebody awake and alert, stimulate the brain and then see what happens. And so you can use it as a research tool. If I stimulate here, what happens? You can knock in or knock out behaviors. Years ago, about 20 years ago, I became interested in potentially using it as a treatment for depression. And in 2008, it was approved by the FDA as a treatment for depression. One of the devices was, and just last year, in February, another device was also approved. That device is called Deep TMS, and it's, instead of a single coil that just stimulates the surface of the brain, is actually a whole series of coils that stimulates much deeper in the brain, hence the name Deep TMS. So both of those are FDA approved for treating depression, and in the US now, I don't know, we have maybe 800 doctors out there using the technology to treat depression, and it's getting covered by insurance. I estimate that each and every day there may be between 8 and 12 people who are now reaching remission. That is, their depression is totally gone as a function of getting treatment with depression. These are people who have tried and failed medications and talking therapy. So it's starting to make a significant impact in the lives of Americans. That's just in America. Around the world, it's also making an impact. I don't really know how to guesstimate how many people. But so it's starting to improve the lives of some people. What's really interesting, though, is if we can use it to treat depression, can we use it to treat other brain disorders? So DBS stands for deep brain stimulation. That's where you actually stick a wire deep in the brain and then hook it up to a generator that's typically located in the chest wall. And that sends a small electrical stimulation straight to these deep parts of the brain where the wire sits. So with that technology, which is more invasive, it requires drilling a hole into the brain and sticking a wire, so you have hardware, there's a risk of the surgery. But that technology has really transformed the treatment of Parkinson's disease. So with Parkinson's disease, you get loss of dopamine neurons in the brain and a tremor. And in most people, that responds in the early stages to supplementation with dopamine. But after a while, the medications no longer work. And so in those people, with deep brain stimulation, you can stick a wire straight into a deep part of the brain, turn it on, and the tremor immediately goes away. So it's FDA approved for the treatment of Parkinson's, especially the tremor. It has the unique scientific appeal that we could actually go focally, selectively to discrete parts of the brain and turn it on. So it's intellectually a little bit more appealing in terms of rollout into the clinical setting. It's dangerous. You have to have neurosurgery and implantation of a device. And so it's simultaneously more interesting, more appealing, but on the other hand, a little bit more invasive. So yet another one of these technologies where we can stimulate the brain involves stimulating the vagus nerve in the neck, which runs right through here. The vagus nerve is a very big nerve. It's how I know right now whether my stomach is full or not, whether I have chest pain, whether I'm short of breath. So it's actually how we figure out what's happening in our body. It's how our brains get that information. So stimulation of that nerve could theoretically change my view of whether I'm full or not. That technology is approved for treating epilepsy, so people who have seizures and they don't respond to medication. If you stimulate the vagus nerve for reasons that we still don't fully understand, you can actually immediately stop a seizure and actually improve long-term management of seizures. I also found years ago that stimulation of that nerve intermittently can help people with chronic recurrent treatment-resistant depression have a little bit better course, so it actually has an antidepressant effect. Yes, so with all of these new tools, how could we use them for obesity or eating disorders? I'll start with the vagus because that's the most interesting, because I know whether I'm hungry or not because of the signal coming through the vagus. So theoretically, if you could stimulate the vagus nerve, you could fool yourself into thinking that you're full even though you're not. And so several groups have looked at whether stimulation of the vagus could be a treatment for obesity, kind of like gastric bypass. There was a very good study in some obese mini pigs where they did that, and the pigs who actually had the stimulation, instead of gaining weight, they lost weight. And if you put a series of different food bowls in front of them, one containing high fat, one of them containing kind of granola, they would choose the granola and ignore the high fat. So it changed both weight gain and actually food preferences. That technology has not been used in human trials yet, but the animal studies are quite supportive that you could probably do that in a way that would cause weight loss in obese individuals. For deep brain stimulation, I'm not aware of any studies in obesity, although you could think about going to a spot in the brain called the hypothalamus and stimulate. The problem is the hypothalamus is very small, and one part of it makes you gain weight, the other part makes you lose weight, so you'd have to be very, very focal, and you might miss. But I don't know of any work in humans in that. With transcranial magnetic stimulation, we've been focusing, you could either think about going in and stopping the desire circuit so that people are not as hungry, they don't crave food as much, or you could think about beefing up kind of the parts of our brain that we use to resist eating, kind of our control circuit. So most of the studies have been looking at stimulation of the prefrontal cortex, the area that you use to kind of control craving. And there are some intriguing studies going on now in the addictions and smoking, where you actually make people crave, and then you treat them simultaneously, the prefrontal cortex. So you treat the part of the brain involved in stopping the craving. I'm not aware of any studies right now going on in clinical trials in obesity, but we've shown in simple lab studies that you can make people crave food and stimulate and then knock down their craving. So at least in the lab studies, we've shown that you can modify craving with TMS.